Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Pain patch types, benefits and warnings. A pain patch is a medication-containing patch that is applied to the skin to manage acute, short-term, and chronic, long-term, pain. Some are available over the counter, OTC, and some require a prescription. /r/n/r/n Depending on the type of pain patch you use, there can be concerns about side effects like allergic reactions, stroke, or the possibility of developing a drug dependence. /r/n/r/n This article discusses pain patches, how they work, and what they are used to treat. It also explains how to use a pain patch, doses, and side effects. /r/n/r/n Pain patches are used to treat various types of pain. The patch has an adhesive back that sticks to the skin. It slowly releases the medication into the bloodstream. Some types are available over the counter, OTC, while others are only available by prescription. /r/n/r/n Your healthcare provider may recommend a pain patch if you have pain that doesn't respond well to oral medications, or if you are unable to take drugs orally because of stomach irritation or other conditions. /r/n/r/n Non-prescription pain patches may help treat minor pain such as /r/n/r/n Prescription pain patches may be used for moderate to severe pain such as /r/n/r/n The type of pain patch you should use depends on the type of pain you have and its severity. Your healthcare provider can recommend an OTC pain patch or prescribe something stronger if it's needed. /r/n/r/n Non-prescription capsaicin patches are sold under a few different brand names, including Aspercreme Warming and Salonpas Pain Relieving Hot. Your healthcare provider may recommend an OTC capsaicin patch for mild arthritis pain, minor muscle sprains, minor back pain, etc. /r/n/r/n Capsaicin patches are also available in prescription strength. These may be recommended to treat nerve pain such as the pain from diabetic neuropathy. /r/n/r/n Capsaicin patches contain a substance naturally found in chili peppers, which works by decreasing the activity of nerve cells that cause pain. /r/n/r/n Lidocaine, also known by the brand name Lidoderm, is available OTC or with a prescription. OTC Lidocaine patches are sold under the brand names Absorbine Jr Aspercreme, Lidocare, and others. OTC Lidocaine patches are used for minor pain in the legs, arms, shoulders, and neck. /r/n/r/n Prescription Lidocaine patches are often used for patients suffering from the pain of shingles, postherpetic neuralgia, which can last for months or years after an infection. /r/n/r/n Lidocaine is a local anesthetic that works by stopping nerves from sending pain signals. The topical Lidocaine 5% patch is generally well tolerated, other than mild skin reactions at the application site. It is fast-acting. Some people start to feel relief in as little as 30 minutes. /r/n/r/n Diclofenac epolamine is a prescription pain patch containing a nonsteroidal anti-inflammatory medication, NSAID. It is in the same group of medicines as aspirin and ibuprofen. Also known by the brand name Flector, it can be applied near the area of pain if there is no broken or damaged skin. /r/n/r/n Studies have found that Diclofenac patches are as effective as oral Diclofenac in controlling pain. /r/n/r/n Healthcare providers may prescribe fentanyl patches for severe, chronic pain. /r/n/r/n Fentanyl patches were previously sold under the brand name Duragesic, but generic versions are available. They should be used only by patients who can tolerate opioids and those with long-term, severe pain who can't be treated with other medications. /r/n/r/n A 2018 study found that fentanyl patches were as effective as oral morphine in managing moderate to severe cancer pain with fewer side effects. such as nausea and vomiting. /r/n/r/n Before using a prescription pain relief patch, talk with your healthcare provider about any allergies you have and if you're taking any other medications or supplements. Also, tell your healthcare provider if you're pregnant, plan to become pregnant, or are breastfeeding. /r/n/r/n Some drugs may be safer for you to use than others depending on your medical history and the cause of your pain. Your healthcare provider can help you weigh the pros and cons of a medication, including its ability to manage pain and the risk of side effects. /r/n/r/n Because fentanyl is a strong opioid, it can be addictive. As such, tell your healthcare provider if you or anyone in your family has abused alcohol, street drugs, or prescription medications, or if you have ever had depression or another mental illness. /r/n/r/n Fentanyl patches should only be used by patients who have previously taken and tolerated opioid medications. /r/n/r/n Tell your healthcare provider if you have asthma or any condition with slowed breathing, as you may be advised not to use fentanyl patches. Also tell your healthcare provider if you've ever had lung disease, a head injury, or any condition that increases pressure in your brain. /r/n/r/n Pain patches may have side effects depending on the type used. Check with your healthcare provider or pharmacist about what symptoms should warrant discontinuing the medication or seeking medical attention. If you are using a fentanyl patch, your healthcare provider will closely monitor you during treatment to check for any serious side effects. /r/n/r/n In some cases, a patch can cause minor irritation, redness, blisters, nausea, or a burning sensation where it is applied. These symptoms are usually minor and go away within a few hours. Check with your healthcare provider if symptoms are severe or don't go away. /r/n/r/n Severe side effects are associated with the different types of patches. /r/n/r/n Capsaicin patches may cause severe side effects such as /r/n/r/n Side effects from the Lidocaine patch may include allergic reactions, such as /r/n/r/n Symptoms of an overdose can include /r/n/r/n NSAIDs can increase the risk of heart attack, stroke, and bleeding in the stomach or elsewhere in the gastrointestinal tract. Seek medical attention if you have /r/n/r/n The fentanyl patch can cause severe side effects such as /r/n/r/n While you are using fentanyl patches, you may be told to have a rescue medication called naloxone available in case of overdose. When an opioid overdose is suspected, naloxone hydrochloride should be administered as soon as possible. /r/n/r/n Naloxone hydrochloride nasal spray is currently available both over the counter and by prescription, under different brand names. Prescription options include Cloxxardo, 8 mg/spray, Rixavi, 4 mg/spray, and Rezenapy, 10 mg/spray. Narcan, 4 mg/spray, and Revive, 3 mg/spray, are brand names available OTC. /r/n/r/n Symptoms of an overdose include /r/n/r/n Using a fentanyl patch that has been cut or damaged may cause you to receive the medication too quickly rather than slowly over time and could lead to overdose or death. /r/n/r/n Heat can increase the dose of fentanyl delivered by the patch, which can have the same consequences. While the patch can be worn while bathing, avoid long, hot showers and baths. Likewise, avoid hot tubs, electric blankets, and heating pads. /r/n/r/n If you experience any severe side effects or signs of an overdose from any medication, remove the patch and call 911. /r/n/r/n Be sure your healthcare provider is aware of any other medical conditions you have, including liver or kidney problems and high blood pressure, and any medications and supplements you're taking. /r/n/r/n. Do not use capsaicin patches if you're allergic to chili peppers or you've had an allergic reaction to topical capsaicin. /r/n/r/n. Capsaicin is unlikely to interact with other drugs, but always let your healthcare provider know about any OTC or prescription medications you take as well as any supplements you may be using. /r/n/r/n. Tell your healthcare provider if you are using any medications, including /r/n/r/n. The Diclofenac epolamine patch can interfere with the effects of other medications or cause drug interactions. Let your healthcare provider know if you're using /r/n/r/n. When using a fentanyl patch, do not drink alcohol or take street drugs, as it can increase the risk of severe side effects or death. Tell your healthcare provider about any other medications you're using to avoid life-threatening interactions. /r/n/r/n. Drugs that can cause a serious interaction include benzodiazepines such as /r/n/r/n. Not all drug interactions are listed here. Always let your healthcare provider know about any medicines or supplements you're taking before you start using a fentanyl patch. /r/n/r/n. Fentanyl patches can be dangerous in the wrong hands or if applied improperly. The U.S. Food and Drug Administration, FDA, has issued warnings about fentanyl patch safety after a number of accidental overdoses were reported. /r/n/r/n. Overdoses have occurred when more rn1 patch is used at a time, when a patient applies heat to the patch, and when a non-patient such as a child accidentally comes into contact with the patch. According to the FDA, young children have died from accidental exposure when putting it in their mouth or applying it to their skin. /r/n/r/n. In 2013, the FDA required color changes on the writing of duragesic, fentanyl, patches. The change was made so patients could more easily see the patches and notice when they fall off to avoid accidental exposure to kids and pets. /r/n/r/n. The adhesive side of the transdermal patch should be placed firmly on the skin per the label and healthcare provider instructions. Never place a patch in an area for which it is not prescribed, and never use more than one patch at a time unless approved by your healthcare provider. /r/n/r/n. All listed dosages are according to the drug manufacturers. Check your prescription and talk to your healthcare provider to make sure you're taking the right dose for you. Some common doses are as follows: /r/n/r/n. Patients should wash their hands before and after touching a patch to avoid contaminating the drug and to keep the drug from being applied to an unsafe area such as the eyes or mouth. /r/n/r/n. Pain relief patches should only be used on skin that is not broken, cut, or scraped. Do not use a pain relief patch that has been cut, torn, or damaged unless directed to do so by your healthcare provider. /r/n/r/n. Store all pain patches at room temperature and away from excess heat. Like all medicines, pain relief patches should also be stored away from children and pets. /r/n/r/n. Fentanyl patches are dangerous even after being used because they still contain high amounts of opioids. The best way to dispose of a used fentanyl patch is to fold it in half, so the adhesive side sticks to itself. A used patch should be flushed down the toilet. /r/n/r/n. Pain patches are patches that contain pain-relieving medication and are applied to the skin. They are available over the counter or as prescribed by your healthcare provider. Pain patches are usually recommended if you can't take oral medication because of side effects or if you have pain that does not respond to oral medication. /r/n/r/n. Capsaicin and Lidocaine patches are available without a prescription. Stronger versions containing these medications are also available. Other prescription products contain NSAIDs or fentanyl. These drugs may interact with other medications or cause severe side effects. Always tell your healthcare provider about other medications you may be taking before using a pain patch. /r/n/r/n. rxcardclub.com Get a free prescription drug card and save up to 80% on prescription drugs.